Hey, I'm going to cover the top 3 Medigap or Medicare Supplement plans for this year and going into 2026. And then also I'm going to tell you about a special enrollment opportunity for a lot of you guys who are going to be losing your coverage in this AEP season in 2026 in October, November, December, and going on to potentially a new plan, or maybe you're unaware, you actually have a guaranteed issue to go into a Medicare Supplement. We're going to talk about that at the end. Stick around, I'll be right back. So let's start with the Plan G. Typically, and everybody has their own opinions, but for us in our office and most people that we talk to in our given areas that we are doing Medicare supplements in, we are finding still Plan G is often the choice or selection that people want to have. So a Plan G basically is simplified in that it's going to cover 100% of everything except for your Part B deductible. Now this year the Part B deductible is $257. That is adjusted every year based on the cost of living adjustment. You'll see your Part B premium go up, the Part D premium, and then usually the Part A deductible on original Medicare. So on original Medicare you have a Part A deductible, you have a Part B deductible, and then you have 20% of the billable rate, and that's how standard original Medicare works. Part A is hospital. That's just think of a hospital or the physical aspect of a hospital. When you go into the hospital, you have a bed, you know, the jello, the nurse, the things that are attached to the hospital. And then everything outside of the hospital falls under Medicare Part B called outpatient services. That's where a specialist will come. If a specialist comes into the hospital, they don't work for the hospital. They work for a group or themselves, and they bill through Medicare Part B services. So you have a Part B deductible of $257 and then 20% billable rate. So if they come in during a heart surgery, open your chest, you're there for 4 or 5 days, you're released, you're going to have a Part A deductible, and then you're going to have your Part B deductible, and then 20% of the billable rate. So if you didn't have a Medicare supplement, you could be looking at several thousands of dollars just on original Medicare. So enrolling into a Plan G is going to only require you to pay the monthly premium. Right now, the national average premium is usually around $130, $135 for a male or a female nationwide. And then given in your area based on your zip code, it could be higher, it could be lower. Like for us, we use a plan finder, a quote tool that allows us to look at the plan options available in the area. Historically, you want somebody to be able to look at a plan historically over the last 5 to 7 years that have not had double-digit rate increases. A lot of times there's new plans in an area that come out. We typically don't enroll people into brand new plans. They'll have lower suppressed premiums, but there's no actuarial data to show whether or not they're going to sustain those rates. And then a lot of times they'll have double-digit rate increases over the next 5 years. So look out for that. That's just a hint of warning to be aware of who you're dealing with when it comes to your licensed agent or agency. They need to be educated in the Medicare supplement space. But Medicare Plan Gs are very simple. You pay a Part B deductible, and then 100% of all the hospital costs, the deductible and costs that can incur beyond so many days in the hospital is covered 100% by the supplement, and then the Part B 20% is covered. So basically for that year, you're paying the premium, the one-time Part B deductible, and 100% of everything covered for both Part A and Part B services, anything dealing with your health, everything deemed eligible under Medicare. I always say cosmetic surgeries are not going to fall underneath that, Botox, you know, a nip tuck and things like that are cosmetic are not going to fall under Medicare, but anything that's medical or hospital needed is going to fall under Medicare Part A and Part B and be covered by that Plan G. That's how the Plan G works. We're going to roll right into the Plan N in just a second. So the next top contender on the list is a Plan N. Plan N works exactly the same way as a Plan G. The only really difference in the two is that Plan N, the doctor or specialist, when you go to a doctor office, which is going to fall under Part B services, it's in the outpatient category. When you go into the doctor office, they can charge up to a $20 copay. Most doctors are going to charge it, some won't. So if they don't, great, flip of the coin, but you're going to probably be billed a $20 copay. Plus, if you go to the ER and access emergency or urgent care, you're going to pay a $50 copay. Otherwise, the Plan N, what we're seeing right now is the premiums on the Plan N are really, they're less. You're going to usually see about a 30% decrease in premium cost. And then right now they are stabilized and not having as big of price increases because of the Inflation Reduction Act and them sunlighting the Plan F in 2020, January 1st, 2020, we've seen a huge increase in Medicare supplement premiums. When it came to people turning 65 prior to 2020, they could enroll into a Plan F. Now there's no available eligibility to enroll into Plan F unless you fall into a guaranteed issue, which would mean like if you lost your Medicare Advantage plan or you lost your credible coverage with an employer, you can go into a guaranteed issue. With some carriers, they're still deeming their Plan F as their guaranteed issue plan. We'll be talking about that a little bit later, but those are just moving parts of Medicare that you may not be able to figure out on yourself. But the Plan N has a suppressed premium. You still have to choose a Part D plan on the Plan G or Plan N. You want to have a standalone prescription drug plan that's going to cover your medications. The Medicare Supplement only covers Part A and Part B services, but the real big difference is you're going to have some copay costs out of pocket. You're going to have an ER copay cost, but really 100% of everything else is covered. You're paying those copays to get the ability to have a suppressed premium. So I tell people, if you access care, a couple times a year and you're not planning, obviously we don't plan for emergencies and crazy catastrophic things happening to our health, but you're just a healthy person and you're like, hey, I don't mind paying $20 if I go to the doctor office and that's what they bill me, or if I go to the ER, I pay the $50 copay, then a Plan N can be a great fit. And then you choose again on the Plan G or N, you want to pick up a prescription drug plan again so you don't incur a Part D penalty later on when you do need the drug benefit, even if you're healthy and you're choosing a Plan N just based on health level and access of care and having great coverage. Now, for the Plan G and the Plan N, this is really important for one of the things that Medigap and Medicare Supplements are known for. They do not have a network. Now, we just saw legislation get stopped this year over the last few weeks, legislation that was going to incur prior authorizations for certain items on original Medicare. They were going to have 6 key states that are going to be covered under that prior authorization. That has been paused and is not going to come into effect as of January of 2026. What I would say is original Medicare now doesn't require prior authorizations. That means if you go to the doctor and the doctor wants to do hip surgery on you, you do not have to have authorization from Medicare or the supplement to do that. You can the doctor can issue the surgery or send you to a specialist. They can issue the surgery and you can go in and have that surgery done without prior authorization. But coming in the future, now that this legislation is on the table, there's a lot of fraud, waste, and abuse, and just be aware that in the future we'll have education content on our YouTube channel and you'll see other people talking about prior authorization. There may come a time when you do have to have authorization done, but right now you do not have to have authorization done, nor are you limited to any network given in a certain area. You can go anywhere in the U.S. and go to any doctor, any hospital except original Medicare Part A and Part B. Hey, so the third option, a lot of times people are looking for a much lower premium cost with a higher deductible benefit, is the High-Deductible Plan G. So the High-Deductible Plan G kind of works like this. I'm going to read through this so I don't miss anything. Then I'll explain exactly how this works. It has a lower premium with a larger deductible. So there's a $2,870 annual deductible in 2025. That'll adjust again in 2026. We see just watch in case the deductible changes. But in 2025, it's $2,870 deductible. You pay Medicare approved deductibles and coinsurance copays up to the $2,870 each calendar year. This includes the Part B deductible of $257. A separate $250 foreign travel emergency deductible applies after you hit $2,870. The policy pays 100% of coverage for the rest of the year. So typically starting premium for people that are 65 years of age range anywhere from about $40 to $90. Now, I will say for you guys that are like, hey, I'm healthy and I just want a high deductible Plan G or a high deductible plan, this is a great fit for those people because the max out of pocket you're going to pay is $2,870 deductible. Here's the caveat. I would encourage you to probably put a hospital indemnity and cancer rider, because the two major things you're going to run your cost up is hospitalization, and then if you get diagnosed with cancer and have to go through cancer treatment with radiation and chemo. So you can usually at the age of 65 add a cancer hospital indemnity or what we call copay plan to cover those gaps or cover and fill in kind of that margin of covering up to the max out of pocket for this plan. Hospitalization is going to cause it to go up quickly. And then if you get diagnosed with cancer, and for about $35 to $55 a month, you can add a policy to cover those areas and gaps in that. So that's called a hospital indemnity, and typically with a cancer rider or a cancer plan or a hospital plan. So if you're confused about that, and if you're looking at high deductible plan Gs, you need to ask the right question, and you really need to understand, what am I obligated to pay? Because you enroll in this because the premium's low, but then have to pay up to the deductible, and you don't have that money set aside. You're going to be very frustrated. And then if you don't choose a hospital indemnity or a cancer rider, and you put in the hospital and you have some high costs there up to the deductible, it can be frustrating when you could, for a little bit of money each month, insure the liability of that cost. And there's easy ways to be able to do that, just having somebody explain and guide you through that process. So those are the three major or kind of top contenders when it comes to Medicare supplement plans or Medigap plans: Plan G, Plan N, the high deductible Plan G. And again, on the high deductible Plan G, there's no drug coverage. You're going to have to enroll into a prescription drug plan to have drug coverage, and I would encourage you to do that to eliminate the drug coverage benefit as well. If you have questions about high deductible plans or the Plan G or Plan N, we'd love to be able to jump on a phone call and guide you through. Now I'm going to go into the last most important thing that you need to understand that's very critical for Medicare beneficiaries. So let's talk about guaranteed issue options for Medicare supplement plans. This is a huge issue going on now, coming into 2025, going into 2026. Last year, 1.2 million people lost coverage with either a Medicare Advantage plan or prescription drug plan. This year alone, going into 2026, one of the major carriers has already said they're going to eliminate 600,000 members Medicare Advantage plan. So how does that apply to you? If you are losing maybe a PPO Medicare Advantage plan, or your Medicare Advantage plan is being pulled off the market, it actually qualifies you for a guaranteed issue plan for a Medicare supplement. Now, you can enroll into a Medicare Advantage plan, and there's nothing wrong with that. We have people that lose or a plan's pulled out of the market. We put them on another Medicare Advantage plan because that's what they want to go to, is zero or very low premium. They have copay costs when they access care, and we can walk you through how and what plans are available in the market. And typically, this gets into the conversation. For years, I've said this: if we're going to enroll people in Medicare Advantage plans, we typically look to HMO plans first, especially in metro areas with big networks, because they're stable plans. PPO plans can go up and down, and what we're seeing now, because people had in and out of network options and all kinds of moving parts with PPO plans, those are the plans beginning to be taken off the market based on medical loss ratios and all these moving parts I won't get into in this video. So the main point is, I'm going to read through a couple of details about the guaranteed issue, talk to you about this, so you're aware that if you are losing your Medicare Advantage plan, this does not apply to prescription drug plan. You may be losing your drug plan, which means you can enroll into another drug plan. This applies to those that are in areas where you're losing your Medicare Advantage plan. If your MAPD plan terminates or non-renews in your area or leaves the MA, you can return to original Medicare. You can get a Medicare or Medigap GI window. Generally, it's 60 days before or no later than 63 days after the MA coverage ends. So here's the easiest way to be able to do it. If you're in the annual enrollment period, October to December 7th or October 15th to December 7th, and you know your plan's going away, you can actually go ahead and use that guaranteed issue time. So your plan's going to start January the 1st. Now, if you're on a Medicare Advantage prescription drug plan, you want to enroll into a Medicare supplement of your choice. Again, we just went over three. I would usually look at people and say, hey, the Plan G is what my clients usually want to go with, because they just pay the Part B deductible and then 100% of everything else is covered. Then you're wanting to enroll into a Part D plan. Again, that credible coverage for Part D. So Medicare Supplement Part D, you can enroll during the annual enrollment period because your drug plan is going to go effect January 1st. If you don't do anything with your Medicare Advantage prescription drug plan or MA plan, it's going to end December 31st. And you're going to be left with original Medicare with no drug benefit come January. But based on the rule, you can have 60 or 63 days to still choose to go to GI guaranteed issue Medicare supplement plan, or you can pick a prescription drug plan based on this special election period. But you need to be aware that you need to be able to have coverage January 1st. So what does that mean? During the annual enrollment period is when you want to make your plan selection. Again, that's a confusing rule and confusing moving parts. Another part of this, for people new to Medicare on or after January 1st of 2020, your 65th birthday, first eligibility, or later than 2020, you need to realize that based on where you live and based on the state that you live in, the guaranteed issue plan, it may be, as I just said, I had a carrier earlier that we tried to put somebody into a plan G. I made a mistake. It was supposed to be a plan F for guaranteed issue. So there's several different plan options in certain markets for guaranteed, and in certain markets it's not. Prior to 2020, if you're losing a Medicare Advantage plan, you can enroll, their guaranteed issue is going to be a plan F usually. So this is kind of the rule. The federal guaranteed issue events, you have the right to buy plan D or G. These replace C and F. And depending on the GI situation, also plan A, B, K, or L. In trial right situations, if you are enrolling into a Medicare Advantage plan, you're within your 12-month window. First time you've ever been enrolled into a Medicare Advantage plan, you have a 12-month window called a trial right period, and you can go back to original Medicare and pick up a Medicare supplement and a drug plan during that 12 months. Stick around, I'll be back for one last point. So I'm going to read this to you and explain kind of in a nutshell what this means, and just something that's important because in certain states, many states adopted the NAIC update and further expanded GI or guaranteed issue to include M and N and or birthday or anniversary switching rights. So what does that mean? You know, you have to always check depending on what state you're in. If you're in a birthday state, that means for your birthday every year, you can change your plan. Kentucky just added a birthday rule, which allows people that are on a Medicare supplement plan to change their Medicare supplement plan every year on their birth date month. You may be like, I don't know what the rules are. A, check. B, have a licensed professional who knows what they're doing to help guide you through that. If you don't have somebody, we'd love to be able to jump on a phone call with you, to walk you through, see what your problem is, and guide you through to the solution. You may not need to do anything, or if you are getting an ANOC at the end of September, by the October 1st, you're going to have an annual notice of change. And in that annual notice of change, it's going to let you know if your plan is being terminated. Then know automatically, I have a guaranteed issue, and you have an option during the AEP season to enroll back into another Medicare Advantage plan for January 1st effective. Making sure if you're on an MAPD plan that you go back into another MAPD plan because you want more than likely the drug benefit. My encouragement would be look at the HMO plans in your market. If you're in a metro area, HMOs are great. If you're in a rural area and you're on a Medicare Advantage plan, this is great for you because you're going to have a guaranteed issue to enroll into a Medicare supplement plan and then choose a Medicare prescription drug plan. And especially if you guys are sick or having health conditions and you're like, hey, I've got something chronically going on, I'm at the doctor and hospital, or you've had like cancer diagnosis over the last year and you're going into surgeries and a lot of things happening in your health that's causing a lot of stress for you. This is a great time to be able to enroll into a Medicare supplement plan. You're going to have to be a guaranteed issue based on your state, based on the plan options and things like that. Deal with a licensed professional agency like us. We can walk you through getting into the right plan. So cost versus predictability, premiums versus out-of-pocket exposure, rates, trends, household discounts, underwriting implications outside of GI or your 6-month Medigap open enrollment starts when your Part B activates at 65 plus. That's a long-tailed definition of just saying your situation is unique to you. You having coverage that's ending, you're going to have options. You making plan changes based on whether it be a trial right period, like I said, because you're new to Medicare or Medicare Advantage, you have options there. But if you are losing your coverage this year based on your Medicare Advantage plan in your market, you need to be aware of what your options are. And one of the greatest opportunities to go back into a Medicare supplement is when a loss of credible coverage or loss of plan type like Medicare Advantage is being taken off the market. Pay attention to your ANOC. If you have questions, reach out to us. Guys, if you want some educational deep dive into Medicare, you can always sign up for a Medicare Made Simple workshop. I would encourage you guys going into AEP, if you're confused and you're like, I'm not really sure what's going on, I would encourage you to schedule a plan review with a licensed professional, and then throughout the year, after the first of the year, from January, February, and March, it's going to be open enrollment period, which gives you a time to change from what they call like-to-like plans, a Medicare Advantage to a Medicare Advantage. You need to make sure you make the plan selection and choice based on your need from October 15th to December 7th. Marketing begins for new plan options for the upcoming year, October 1st. So really, we do a lot of plan reviews from October 1st to October 14th. If you guys don't have somebody, I'd love to be able to have the opportunity to work with you. You can click below to be able to get in touch with us. We look forward to talking to you, and if you have any questions, we'll talk to you soon.